In early 2025, Brazil confirmed its first case of bird flu. This news sent shockwaves through the global poultry industry. Countries like China and the European Union quickly imposed restrictions on Brazilian poultry imports. The impact on Brazil's economy was immediate, with financial losses and culling of thousands of birds. Prices of poultry products soared in both local and international markets. Local governments and international organizations stepped in to provide support. However, the long-term effects on Brazil's trade relationships remain uncertain. The case highlighted the vulnerability of global trade to disease outbreaks. H5N1 is a subtype of the influenza A virus, primarily affecting birds. First detected in geese in China in 1996, it has caused numerous outbreaks worldwide. H5N1 is highly contagious among birds, often leading to severe illness or death. The virus spreads through direct contact with infected birds or contaminated surfaces. Governments often resort to culling infected and exposed birds to control outbreaks. Millions of birds have been culled over the years, leading to substantial financial losses. The virus has also affected the livelihoods of farmers and workers in the poultry industry. Despite these efforts, H5N1 continues to pose a threat to global poultry production. Recently, scientists have observed H5N1 infecting mammals, suggesting the virus might be adapting to new hosts. In early 2024, cases of H5N1 were reported in elephant seals in Argentina. On October 30, 2024, the U.S. Department of Agriculture's Animal and Plant Health Science Inspection Service reported H5N1 in a small farm of pigs in Crook County, Oregon. The spread of H5N1 to mammals could have significant implications for animal health and agriculture. Scientists are closely monitoring these cases to understand the virus's behavior. The goal is to identify potential risks and develop strategies to prevent further outbreaks. While H5N1 primarily affects birds, it can occasionally infect humans. In the US, there have been a few confirmed cases of human infection, often involving direct contact with infected poultry. In 2023, a farm worker in Colorado contracted H5N1 after handling sick birds, and, unfortunately, the infection proved fatal. These cases highlight the potential risks of H5N1 to human health. The CDC continues to monitor the situation closely. One of the main concerns with H5N1 is the potential for human-to-human transmission. The virus could mutate and gain this ability. Scientists worry about the virus reassorting in pigs, which can be infected with both avian and human influenza viruses. In 2024, a study in China found H5N1 in pigs, creating new variants. These variants could spread more easily among humans. Experts recommend monitoring and vaccinating pig populations. Preventing reassortment is key to reducing pandemic risk. Experts agree that preventing a human pandemic requires a multifaceted approach. Dr. Jane Smith, an epidemiologist at the World Health Organization, or WHO, emphasizes the importance of early detection. Robust surveillance systems allow us to respond before the virus spreads widely. Vaccination is another crucial tool, with vaccines for poultry helping control outbreaks. Dr. Michael Johnson, a virologist, advocates for developing vaccines for high-risk populations. Public awareness and education are also vital, including practicing good hygiene, and avoiding contact with sick birds. Governments and organizations must work together to implement these measures effectively. Preventive measures are essential to safeguard both animal and human health. The threat of bird flu becoming a human pandemic is real, but it is not inevitable. By taking proactive measures, we can reduce the risks. Surveillance, vaccination, and public awareness are key components of prevention. It is crucial to stay informed and follow guidelines from health authorities. While the potential for a pandemic exists, the current risk to humans is low. Most cases of H5N1 infection in humans have involved direct contact with infected birds. By following safety protocols, we can protect ourselves and our communities. Vigilance is essential in managing the threat of bird flu without creating unnecessary fear.